Well, I think we're set to begin. Hello, everyone. My name is Adriel Bettelheim. I'm healthcare editor at Politico, and I'm delighted to welcome you to today's Politico Live program on closing America's oral healthcare gap. Oral health care is a topic that's sometimes overshadowed by broader national healthcare debates, but it's a subject that offers a lens into so many critically important issues, health disparities and how they cut across socioeconomic lines, how entitlement programs are structured and paid for, how states expand their Medicaid programs. And now, a pandemic that's leaving tens of millions of people without health coverage, that's shredding state budgets, and moving a lot of care from doctors' offices to telemedicine settings. I'm joined today by a terrific panel who will help us look around the corner and see what's next for oral health care, and we'll discuss new approaches to improve access and quality. But before we start, here are some remarks from Elizabeth Giannini, Senior Vice President of Government Relations at DentaQuest, the sponsor of this Politico Live program.
Good afternoon, and thank you for joining this important conversation on the very real and growing racial and economic disparities within the oral healthcare system in the United States, and what those disparities mean for the overall health of our nation. I am Elizabeth Giannini, Senior Vice President of Government Relations at DentaQuest, and Politico's proud partner today. While many of us don't think twice about visiting the dentist for preventative care like cleanings and routine procedures, more than 74 million Americans lack basic access to coverage. And that was before the COVID-19 pandemic upended our economy, leaving millions more without jobs and healthcare benefits. Sadly, lack of access is just the beginning of the story. In this country, Black adults are nearly 70% more likely than white adults to have unmet dental needs, and that has a very real impact on overall health. Poor oral health increases risks, costs, and worsens outcomes for far too many chronic diseases, including diabetes, asthma, hypertension, and depression. Today, we'll hear from a panel of healthcare experts that will examine real solutions to address these inequities and how to build a better system. For example, in order to effectively make transformation, we must first address the fact that in 14 states, Medicaid fails to provide access to comprehensive dental benefits for low-income adults, and a recent CMS rule will make it easier for states to cut those benefits. Likewise, Medicare does not cover dental care at all, leaving 44 million seniors nationwide without access to benefits. These inequities have very real consequences for far too many people. Thanks to the John C. Burr Foundation, we have the opportunity to hear directly from those most impacted in a short film. They have given us permission to share it with you today.
When you look at somebody, you talk to somebody, the first thing you look at is their teeth.
There are millions, tens of millions of Americans every day, every year who don't have access to the oral health care that they need.
We don't have anyone to go to typically because we don't have dental insurance.
When I got out of the Army, I didn't really took care of my teeth like I should have been because I had other things in my mind, and of course I didn't have dental insurance to take care of it.
I see patients every day that haven't been to the dentist in 30, 40 years.
We had a 3-year-old yesterday actually who walked 2 miles to come to our office because the mom could not find transportation.
You do anything you can to not have a tooth pulled. But when you're also raising a family, it's a no-brainer to have the tooth pulled. And that's the way it's gone.
It puts you in a different class. It puts you in a closet.
If you have to live with chronic infection, with chronic pain, even your diet is changed because you can't bear to eat such and such.
Poor oral health can be directly related to poor overall systemic health, creating higher risk for respiratory infections, heart attack, stroke, and an uncontrolled diabetic status.
as a country, we are never going to volunteer our way out of this access to oral health care crisis. The only real solution for addressing this phenomenal unmet need is systemic change.
Stories like these are why we need major changes. The DentaQuest Partnership for Oral Health Advancement has worked with more than 110 leaders to create a new model that will improve oral health and the overall health for everyone. This new approach, called the 3-Domain Framework, emphasizes the integration of medical and dental care, better use of TeleDentistry to increase access and reduce costs, and prevention through minimally invasive care to address issues before they require costly surgical interventions. State and federal leaders, as well as healthcare industry experts, must be catalysts for this kind of change if we are to achieve healthier communities. Together, we can make change. Thank you, each of you, for being at the forefront of critical conversations like the one we get to hear today. Now, I'll turn it back to Adrielle for what I know will be an informative and action-oriented discussion closing this devastating gap in care.
See the slide.
Well, with that, let's welcome our panelists. First, Dr. Charles E. Moore is Chief of Otolaryngology at the Grady Health System and founder of the Healing Community Center, a community health center serving the uninsured in Atlanta, where he's also director of the Emory Urban Health Initiative. Next, Ann Bottrell, the CEO of the American Dental Hygienists Association. She's the first registered dental hygienist to serve in that position. And finally, Richard Balakovic, visiting scholar at NYU College of Dentistry and president emeritus of the American Dental Education Association. A reminder to our audience, you can follow the conversation on Twitter using the hashtag #PoliticoHealth, that's all run together, and you can tweet your questions at Politico Live. And thank you to those of you who've already pre-submitted questions. I'll try to work them and any of the ones that come in into our conversation. So let's start with the pandemic, the obvious starting point for any health discussion these days. Even before the coronavirus, we saw statistics showing many older and poorer adults are likely to have gone years without seeing a dentist, have untreated cavities, or have no dental insurance. Is COVID-19, the crisis, widening the divide between the haves and the have-nots? Dr. Moore, why don't we start with you? What are you seeing?
Thank you for having me on your program. You're exactly right. I believe it is widening that gap. In the United States in particular, people are more likely to have poor oral health if they're from low wealth communities, if they're uninsured, or if they are members of racial and ethnic minority groups, also immigrants in rural populations, because they have suboptimal access to oral health care. And as a result of the pandemic and all of the things that have come from that, that has contributed even further to lack of access. Partly some from people that have now become unemployed and aren't able to afford care. Also some practices that normally were in place that are no longer in place. And if they did happen to have something in their community that might not be providing services, as well as a result of enhanced measures for safety for the employees and the patients, there are less people coming in, and the fear factor, just the fear of being exposed to something that people are not coming in as regularly as they were before. And I think it's important to note that oral health programs are really taking every measure to be as safe as possible, but taken together, all of that impacts it.
And Rick, any thoughts on the gap and what you've seen in the last 10, 11 months?
Well, yeah, I think that what Charles has talked about is really very much the case. Immediately after the pandemic began, almost all dental practices in the United States closed down. They've reopened now to about 80% of them. But with all of the infection control procedures that need to be in place and so on, although there's capacity, there's just so many issues that need to be addressed, as well as so much of dental care, and not specifically maybe procedures, but the preventive aspect, are often done in schools. And we've seen the impact of the pandemic on that.
Right. The impact in particular to children who would normally receive services in a school setting, or they're covered by Medicaid. Those kids that would normally receive those preventive services are going without. So we're tracking kind of how the pandemic is affecting the delivery of oral health care services. The traditional dental practice is just one of those mechanisms to provide care. So we really have to focus on how are we going to bring oral health care to these populations, and not expect that it's always about coming to a dental practice.
Interesting byproduct of all the schools that have closed and everything. I actually hadn't thought that through. That's it. And staying with you, it's been estimated that about 2/3 of Medicare enrollees have no dental insurance. And there's, of course, this well-documented link between untreated dental disease and other ailments, heart disease, diabetes, what have you. There have been efforts in Congress to expand coverage, maybe even create a Medicare dental benefit. What do you think the prospects are for that, with Congress being gridlocked on healthcare, with the incoming Biden administration dealing so much with the pandemic? Is it a possibility?
I have every faith that it can be a possibility. We've seen evidence that the Biden administration is very focused on healthcare. So for those of us that are in the oral healthcare community, our advocacy efforts have to be very strong. So when you think about seniors or people with disabilities receiving their care through Medicare, you have to just pause a minute and think about one of the most crucial aspects of a person being overall healthy is oral health care, and Medicare just doesn't fill that gap. So we've been involved in some various coalitions to add a dental benefit to Medicare, and we have to keep up those efforts. Consumer sentiment, I think, is really important here. So we took a look at a survey that was done in 2019 to see what did consumers know about a dental benefit in Medicare. 9 out of 10 seniors reported that they knew there was no dental benefit in Medicare. But interestingly, there's no coverage gap between Democrats and Republicans. 41% of Democrats reported they had no dental insurance coverage, and 47% of Republicans reported the same thing. So we have to have a widespread consumer and oral health community who's all on the same page about adding a dental benefit to Medicare, or that population will simply not achieve the goals of Medicare.
Rick.
Well, in adding to what Anna said, as we think about the advocacy efforts, while people may appreciate that there isn't a dental benefit in Medicare currently, what we're seeing is if we think about the age group who are now going into the Medicare population, many of those had dental insurance throughout their lives, and all of a sudden it dropped when they left, retired, and started on Medicare. So it's been a surprise, and so I think that one of those advocacy groups that we can work with are the elders who are now moving into that population, who still need dental care but have had a lifetime of experience with some kind of dental insurance, and now it's gone. So just looking at that as another advocacy approach.
Dr. Moore?
Another thing I'd just like to point out is that it's important to note that oral cavity cancers are more common as we mature. And that's something that our dental colleagues, our primary care physicians, everyone can be aware of, and that we can educate all of our patients on. And without that coverage, it's less likely that those types of things, in addition to what most people think of as traditional dental care, will be missed.
Just to stay on this topic one little bit, when we talk about the dental benefit, I guess there's a lot of different flavors of that. You could have something that's just for basic preventive care. You could have something that's, more covering catastrophic. Is there any kind of agreement, or is that all driven by cost, what this should look like?
Yeah, I think cost is a major concern, but when you take a look at, again, going back to that oral health part of overall health, there needs to be what we would call a benefit regarding the treatment of periodontal disease or gum disease to the lay community, because that has a significant impact on your overall health outcomes. So it can't just be on prevention. Prevention is probably the number one most important thing, but we must also provide treatment benefits if we are really going to affect health outcomes.
All right. So we've already talked a little bit about disparities. We've talked about Medicare, another really important issue. Rick, I want to turn to Medicaid. I think it's 35 states now that provide at least limited dental benefits for low-income adults. And of course, the Medicaid program, dental coverage for kids is mandated. So the Affordable Care Act gave states the opportunity to leverage federal dollars and expand access. What strategies are being employed? What can you tell us?
Well, I think that, just to repeat maybe a little bit, that there is a mandated Medicaid benefit for dentistry for kids. And then there's the CHIP program, which adds to that access. Under the ACA, there was a dramatic expansion through there was a pediatric dental benefit as an essential health benefit, one of the 10 in the ACA. So we did see a dramatic increase in the number of patient visits from kids over these last 10 years. But we still need to find ways to enhance the number of dentists who are providing Medicaid services. It is a patchwork, Adriel, across all the states. And reimbursement levels are different. There's so many other factors that are in place, as well as in adults. It's very different across all these states. So we need to continue to work within what we hope would be the next Congress to really enhance opportunities for expansion of Medicaid benefits. We can talk about all the issues related to cavities and gum disease and so on and so forth. But if you don't have a smile, and this isn't, extreme makeover, it's if you don't have a basic smile, it's difficult for you to get employment. It's difficult for you to have social interactions. A whole variety of other factors are at play here. And so that's why having access for kids and adults remains something very important.
Dr. Moore.
One other thing also I'd like to mention is that, in Georgia, pregnant women are covered while they're pregnant, but as soon as they deliver, that care ends. And that's critically important. These are the individuals that are taking care of the kids. There's some research that seems to indicate that issues related to oral health in pregnancy may lead to premature birth and other conditions, but it's critical that continue afterwards so that we have both healthy moms and children.
Anne, you were going to?
Yeah, I couldn't agree more with what Charles had to say. Another aspect, as Rick was outlining kind of all the complexities, is integration, medical dental integration, and have an integrated healthcare system. Right now in the country, 18 states directly reimburse dental hygienists for Medicaid. But an interesting trend that we're starting to see is hygienists are now being employed in OBGYN offices, in pediatric offices, so that we don't have this separation of medical over here, dental over here, and all the requisite problems that go with that. So really focusing on a medical dental integration is a key to the success of the healthcare system that we hope Congress pays attention to in the next administration.
Dr. Moore.
And to piggyback off what Ann was saying, I've been working with two of my colleagues, Dr. Hope Fusenius and Dr. David Resnick, on training non-traditional providers. So teaching nurse practitioners, teaching physicians assistants more about what to look for related to oral health issues, so that if there are things that they can address them, but they'll also know when and who and where to refer people to. So exactly, to integrate the medical and dental to a much greater extent.
Rick Valcock.
I think, Adriel, one other thing is, as we talk about the impact of dental status more broadly, an unknown fact, I think, and that we need to keep thinking about is the relationship between dental status and national security. And what I want to say is that from the Civil War forward, the number one reason for draft deferments for medical purposes were because of dental status. You didn't have enough teeth to chew and eat on the battlefield. The line was, if you can't eat, you can't fight. And so even into the time of Afghanistan and Iraq interventions, we saw that the number one reason that troops couldn't be deployed was because of their oral status. So again, just these issues of, it's not just having cavities and periodontal gum disease. There's so many other issues at play here.
Well, we've talked a little bit about expanding coverage. I thought we'd swing the conversation a little bit to efforts to expand the dental workforce, to include providers such as dental therapists who can be trained and licensed to perform preventive care and routine restorative procedures. But again, just with Medicaid, it seems like there's a patchwork of state-by-state policies, and there is scope of practice concerns. Maybe, Ann, start with you. How's that affect the range of services performed?
There's great variability across the states in terms of what settings can you provide services in, to whom, how are you supervised, and what is the reimbursement level. So you have seen a rise in dental therapy being authorized in a number of states now, where a dental therapist is kind of in between a dental hygienist and a dentist. So deploying these dental therapists to underserved populations to provide those services has proven to be very effective. But regardless of the provider you are, it's tremendously important to think about practicing to the top of your scope of practice. And the artificial barriers that are there that kind of limit the ability of a hygienist, for example, to provide their full scope really impacts access. What we've seen too is across the states, there's 42 states now that allow a dental hygienist to provide services directly to the consumer. We call that direct access. So it's right along with what I was saying previously, that we have to get providers to go directly to the populations who really have very little access. And we have to allow providers to have licensure portability. The pandemic has taught us about employment challenges now. So to allow people to practice under perhaps a licensure compact, to allow providers to move more freely across the states, particularly to underserved areas, is tremendously important.
Rick, you have some thoughts on scope of practice and just generally this?
Well, just more generally in terms of who's in the workforce. The diversity of the workforce becomes critically important as well. We know that all of us go back to the communities that we came from. And so trying to encourage college students and others who might be considering a health profession's career to consider dentistry, to consider dental hygiene, to consider dental therapy, dental assisting. That how do we build that? I mean, we've been successful, but trying to get an additional cohort of students applying to our programs who come from either underrepresented minority backgrounds or educationally disadvantaged backgrounds into our professions becomes critical as well.
Dr. Moore?
As Rick was saying, multiple studies have shown that there is racial concordance with the patients who prefer, on many occasions, to be treated by someone who looks like that. So exactly as he's saying, creating programs that are pipelines to ensure that there is an adequate workforce. And also, as Anne was discussing, I think another important point related to access is that people often look at what they think are shortage areas, but it's if there could be multiple dentists or dental programs in an area, but they not take the insurance of someone, so that's an access issue. So we've got to improve that access however we need to. And that not only the pipeline, but creating more dental programs, more ways to support the finances of the students so that there's loan repayment in addition to the access.
In terms of settings where services are provided, I couldn't let this pass without talking a little bit about teledentistry. One of the many ways that technology is being used to provide remote care, and of course telemedicine in general has seen an explosion during the pandemic. With respect to dentistry, I guess this can cover face-to-face consultation via video conference and providers sharing images and records. I'm curious what the experience has shown so far. Has it picked up during the pandemic the way that it has in certain other medical specialties? For any of you, Dr. Moore, Rick, Anne?
Well, I think that teledentistry has become something that one of the outcomes from the pandemic. We've been talking about it for a long time. It's used effectively in some rural areas, such as in Alaska, for a long period of time now. But it gave us the opportunity, when there was the closure of so many of these dental practices and the loss of school-based care, to really intensify those efforts. And as you said, the issues are around licensure, what state you're in versus where the patient may be, what kind of reimbursement you get for it, what is the technology. We know that many rural areas don't have access to high bandwidth internet. So I think that we need to take advantage of this moment of the pandemic to try to sustain this, as opposed to letting this opportunity go.
Yeah, I agree. I agree with that. And the dental hygiene community has been very familiar with working in a telehealth environment. You've seen some studies done, particularly like in California, with what we call an expanded practice, an RDHAP, Registered Dental Hygienist and Alternative Practice, who have worked within telehealth teams to expand care. And that's been a very successful model. So just imagine a healthcare team that's medical dental integrated, working at the top of their scope, reimbursed, and working in that telehealth environment. I mean, those are real day-to-day current solutions to addressing access to care that we need to put some momentum and some funding behind in order to make a difference in these health outcomes, especially during the pandemic. Even in private practice, you saw a big increase in the use of teledentistry within that system, because people had to use technology differently to not have to take on and take off PPE as they were seeing different patients in different operatories. It makes total sense. But now we've seen that come back down a little bit, more in favor of the traditional system. So teledentistry, I think, made a big impact on the community. And now we have to just keep that going and use telehealth to reach more people.
And just to be clear, are the privately insured, are they paying the same for a teledentistry visit as an in-person visit, or is that still being hashed out?
I think it's still being hashed out.
It's still being hashed out, but I think it depends on the insurance company and other things. But coding is always an issue in healthcare for reimbursement, and those codes are being developed. And again, the reason to help to work to sustain this after the pandemic is over.
And one of the things that I think the dental community has done really well, and why dentistry is being viewed as being safe, is we've used teledentistry to screen patients before they even come into the dental practice. And that's been one of the factors of our success, is being able to talk and consult with people and ask questions prior to them even arriving in a dental practice. So that needs to continue as we move forward as well.
And I think it would be phenomenal if we could somehow create really medical teams so that there's much more integration of the telemedicine and teledentistry. And I think that'll improve everything.
Well, we have some questions from the audience, and I want to get to that, especially since we're sort of on this theme of alternate care settings and the pandemic. One audience member asks, what's the role that you see for home oral care in mitigating this oral health care gap and during the pandemic specifically? Who'd like to tackle that one first?
Well, I think that there, while home-based delivery of dental care of any kind has been very limited. I mean, there's some folks who have been doing it in various states, but pretty limited. One of the features of dental schools that have been in metropolitan areas in particular is the use of mobile vans to bring the dental care to neighborhoods that might otherwise not have access. One of the things that we're seeing in Silicon Valley is that some of the companies, these are not people who have problems with access to care, but the model is there to now deliver, coming in essentially with a tractor trailer and having all the dental services in the box of the trailer so that their employees don't have to lose time to go off to go to the dentist and return, that they can get their dental services there. So there's models that are growing out there, not necessarily home-based yet, but delivery through mobile vans and other kinds of delivery local to either an employer or a neighborhood.
Do any tweaks have to be made to dental education when you're taking these things into consideration?
If I can just follow up with that, and just that, much of dental education has traditionally occurred within the footprint of the dental school itself. Dental clinics that were run by the university to allow students to treat patients under the supervision of faculty. About 10 years ago now, for example, the Robert Wood Johnson Foundation funded the Dental Pipeline Project that was meant to expand opportunities for students to treat patients under faculty supervision in the community, in federally qualified health centers and other kinds of places. And what the consequences of that was, that the added 6 weeks out in the community resulted in a willingness of those graduates to work within communities that might have difficulties with access to care. So I think that those are the kind, yes, within the educational model, these are the kinds of things. Many dental schools have mobile vans. Hygiene programs have dental vans that can go around and provide some of that care.
Yeah, it's curriculum revisions are at the top of the list of what's needed, and the pandemic's only made that stronger. So when you think about when students get exposed to these kinds of experiences of treating underserved populations, it can sometimes come at the end of their curriculum versus switch the thinking of our students and expose them to underserved populations in an integrated care model at the beginning, not at the end. Because there can be an approach of, well, I have to take on these experiences while I'm in school, but will that change my choice of where I'm going to choose to practice? So we might have to relook at what kind of students do we admit into our programs? Those that have a very community service base, so that we expose them to opportunities like this, but completely revise the curriculum along the way of doing dental procedures. Sure, they have to be educated and qualified to provide services, but less focused on, I need to understand how to do clinical services and meet for example, the 2030 healthy people objectives. We have to look at outcomes and how the curriculum affects that.
Dr. Moore?
Yeah, I'd just like to highlight one other point that we've mentioned indirectly. It's oral health literacy.
Yes.
It's important to realize that the majority of the time, most people will not, of their life, they won't spend it in a dentist's office, that they have to do things in their own communities, in their own homes. And by providing the appropriate things that someone can do to prevent oral health issues, that will benefit everything that ultimately will need to be treated or can be seen earlier, and provide hopefully more groundswell for folks to know exactly what oral health is.
We've had a few questions from the audience about preventive care, and I thought I'd consolidate several sort of along the lines of what tools have you found successful in prompting families to use covered preventive care services in terms of setting and keeping appointments? Are there any best practices or lessons learned?
Yeah.
Yeah, I think the part of that answer is that integrated care model. So that if you've got a mom, a pregnant mom, or maybe who has children with them, you can lessen that prevalence of missed appointments and whatnot if they're going one place to receive care, not 3 different places. We also know that there's a lot of caregivers involved. Colorado, for example, is leading the way in a medical dental integration and getting responses from people who are receiving service within an integrated care model. And the outcomes are very positive about being pleased with the care. I don't have to go 2 places. Transportation is another issue we haven't talked about yet as being a problem of receiving care. So if I have transportation problems and I don't have a car and I'm late for an appointment because I had to take the bus, shouldn't we be thinking about that? And we could lessen that burden of receiving care in multiple offices and have it in one.
Rick, and then Dr. Moore.
Well, I think that just to pick up on what Ann is saying is that this integration of medical and dental care is really what needs to be done. And so that in the places that we're seeing that patients get their health care and their dental care all in one place, either in an FQHC or in some other kind of health system, that when they come to the for example for an OB/GYN appointment, they can see on the screen, the receptionist can see on the screen, oh, you need to have your 6-month checkup at the dental clinic. And when they go to the dental clinic, the receptionist there with this common electronic health record can say, oh, you're due for your mammogram. And can I make that appointment for you? So this integration that Ann's talking about is really critical to the future. And those places where it's begun are showing great evidence of encouraging preventive care that goes across the board. And the mouth is a part of the body. Inflammation in the mouth is inflammation just like anywhere else in the body. And so we have to stop thinking, oh, you have your medical care and your dental care and your medical insurance and your dental insurance. No, we need to be integrated in many more ways than we already are.
I'd just like to amplify what Rick was saying. At the Healing Community Center, we do just that. We have oral health and medical services. And so there are prompts, not only at the front desk, but for the providers to ask, oh, have you had your cleaning for this period of time? And then each time they come back, that's reiterated. And then there are also some simple things, just reminder calls, either automated or in person, because in a lot of instances, there are a lot of competing priorities. And it's best to try and keep those appointments at the front of people's attention.
Well, we have a few more questions. I'll try to get in the remaining time. We're going to circle back to health disparities and measuring results. One audience member asks, how can we improve measurement systems for oral health outcomes and predictive analytics?
Well, Adrian, I think one of the critical things is having adequate databases. I mean, certainly CDC and HHS do a variety of different surveys and put data together, but we need to get better data about dental status, its relation to overall health status, demographic differences, and so on and so forth. But I think that the concept of having a better data warehousing for these kinds of things, that we can have the metrics to then look at outcomes and quality.
I think one of the things in the pandemic, the health IT aspect is just fascinating, and how the health information exchanges are being harnessed, and the data gaps that we've seen, not just in dentistry, but overall, especially tracking the virus. Dr. Moore, you were going to say?
Yes. So with the same group of providers that I mentioned earlier, we've created an app that allows for analysis of the quality of life that a patient experiences, so that a person can be go through a very simple process on an app before they're seen. That can be tracked over time. You can make sure that things are improving, and if not, why. It can be compared to other sets of data across the country. So things like that will really make a tremendous difference. And as Rick was saying, collecting all that data from an electronic health record, medical and dental together, will help us move things forward.
Well, I think we have probably time for one more good one, and maybe to try to sum this discussion up. On a positive note, once the oral health care gap is closed or narrowed, what actions or steps will be taken to sustain this and to avoid backsliding?
Well, let's assume that we get to a point where the gap is closed or reduced. Then it becomes, I think, critically important to start with health literacy issues, as Charles was talking about, early. I'm a pediatric dentist. My experience in providing care in Boston and in New York City, I think that what we've seen is that if we can get women during their pregnancy to better understand what happens from a dental perspective, the eruption of teeth, the changes that occur during childhood, the importance of simple toothbrushing, 2 minutes twice a day. The issue for me really becomes one of encouraging health literacy as a way of ensuring that we continue in the future to maintain that reduction in the gap, whatever that may be.
And I attached to the health literacy, I think a pandemic outcome is going to be poverty. You know, what's happening now with the millions of people enrolling for unemployment? And if I'm so concerned about feeding my family and having a home and not getting evicted, and if I live in a food desert, am I going to think about oral health? Maybe not. So I think it calls upon our new administration and Congress to really think about the needs of the common person and really focus on employment and reducing poverty, because health literacy has to become part of a much bigger program.
Dr. Moore, you get the last word.
Sure. I couldn't concur more with my esteemed colleagues. Education is the key for everything. And health literacy will make the biggest difference. And as Ann was saying, with all the competing priorities, you have to find a way that people can still get what they need where they are, and until they're able to get additional things to help them move to a higher level.
Well, I think we could probably go for easily another hour or more talking about all the socioeconomic, the practice level, and the federal policy aspects of this. And maybe we'll have to have another one of these panels, but unfortunately, we're out of time. So I really want to thank again our fabulous panel today, Dr. Charles Moore, Ann Bottrell, and Rick Balakovic, for joining us this afternoon, for sharing your thoughts and insights with us, and for taking time out during a very busy time of year. Also, a big thank you to everyone who is tuning in on the live stream today for your interest and for your questions. And thank you to DentaQuest for sponsoring today's Politico Live event. Happy holidays to everyone. Take care and be safe.
Thank you to DentaQuest for sponsoring today's discussion. With more than 74 million Americans lacking access to dental coverage and 45 million Americans living in areas with a shortage of dental health professionals, DentaQuest is working to close the oral health gap. Its mission is to improve oral health for all Americans, and they are doing that by revolutionizing dental care, making it more affordable and easier to access with a greater focus on prevention. Visit DentaQuest.com to learn more.